ID group. Fourth group is they are having obesity and they are having insulin resistance. After some years, they are developing insulin deficiency. This is called an IDR group. Out of 4 groups, we have one group where there is no insulin resistance, there is no insulin deficiency, and they don't progress into glycemic deterioration. Second group is they are having insulin resistance as well as insulin deficiency, and they are progressing rapidly to glycemic deterioration. Third group is they are having only insulin resistance, wherein there is a metabolic syndrome by obesity, but they don't have insulin deficiency. And there is another group, especially seen in India and Chinese and East Asians and South Asians, are their abdominal obesity. They are not obese, they are normal weight, but they are having insulin deficiency. So these 4 categories has to be made out very early in the stage of the progression of the disease. How do we make out is by ask the patient to come in fasting, take a fasting blood sugar, take a fasting insulin, and give a oral challenge glucose. Same with 0 and 1 hour and 2 hours, you follow up with the insulin, with the glucose. So what happens is you have 2 types of curves to say whether the patient is having insulin resistance or the patient is having insulin deficient. So any beta cell HOMA be less than 35, now we are following this using the Oxford calculator, which is there online. If the HOMA beta cell, if it shows less than 35, that is going into insulin deficient group. Here the insulin levels will be very low, but the fasting blood glucose will be very high. So baseline blood glucose will be very high in this group of only insulin deficit, and they don't be obese, they are normal weight, they don't have this high obesity and high carbohydrate. These are the one insulin deficit group. Here there is no point in reducing the weight, no point in giving a insulin sensitizers. Next group is the insulin resistant group. Insulin resistant